ultimately, again, when we take that step back and we say, what are the foods that are most nutrient dense? And what are the foods that our bodies have been optimized on that bioavailability front, right? Those are two very key questions that we need to ask as human beings.
Welcome onto the podcast, Dr. Philip Ovadia. I'm so excited to chat with you today about health, heart health, prevention, all the things. So welcome to the podcast.
Thank you, Dr. Gupta. It is great to be here with you and really excited for this conversation with you and your audience.
For sure. So let's kick off with your background. I know you are a cardiothoracic surgeon. You've operated on thousands of hearts before you fixed your own metabolic health. And so tell us a little bit about that background so people understand who you are. And then what was that moment when you realized that, gosh, my health isn't well, the patient's health who is showing up on my table isn't well, and this is really one and the same problem. And you wanted to get behind really how to help people prevent showing up on your table.
Yeah, ultimately, my personal story is a big part of the my professional evolution now. So I've been a heart surgeon over 25 years. Like you said, done thousands of heart surgeries, and for much of that time, up until about 10 years ago, I was morbidly obese. I was pre-diabetic. And I came to a realization that I was going to end up on my own operating table, so to speak. I was following the same path that I had seen in so many of my patients. And what was really troubling to me was I realized that I didn't know how to fix it. The advice that, I had learned in school to give my patients, and the advice that I did give my patients for many years, wasn't working. It wasn't working for them and it wasn't working for me. And it's the advice we've all heard, right? Eat less, move more, eat a low-fat diet, right? Follow the food pyramid as it was. And I just started, questioning. There's got to be something else. There's got to be something that I am missing, right? Because if I can't improve my own health, how ultimately am I going to help my patients? And that led me, again, to start to ask some different questions. I think it opened me to some different information sources. And ultimately, I started coming across things like low carb diets, low sugar diets. Started understanding the hormonal influences of what we eat and how it may not just be how much we eat, but it's what we eat in particular that really can come to influence our health. And ultimately, I was able to lose, 100 pounds. For really the first time in my life, because I had lost weight before that, I was able to maintain the weight loss. And I also came to understand the deeper kind of health changes from, going at first it was a low carb diet, then it became I think what most people would call a ketogenic diet. And ultimately it has gone now to a carnivore diet. A diet very heavy in meat. And that is, of course, very counterintuitive within the heart disease space. So I can now say, 10 plus years into that journey, I am in the best shape of my life. I'm the healthiest I've ever been. And I, along the way, came to realize some things about heart disease weren't exactly how I had been educated. And that has now helped me and really refocused my career largely. While I continue to do heart surgery, I am now overly focused, increasingly focused on keeping people off the operating table.
Wow. And I know that's the title of your first book, Stay Off My Operating Table. And I know that it was about metabolic health at the root cause. So, why did you feel that this second book was necessary? And I was reading your book last night, Stay Off My Kitchen Table. And in this book, you take a different approach. You're not talking about just metabolic health, you talk more about gut absorption, bioavailability, are we actually absorbing what we're talking about here, or are we wasting our time and our money? And so, what were you seeing in the group of people who are already doing everything right? Because so many of us are doing everything right. We're trying to eat organic, trying to eat well, trying to eat food in the right order, trying to eat nutrient dense foods and superfoods. And so, what were you seeing that led you to write this next book?
Yeah, so, the realization that it's not just the food that you put in your mouth, it's what your body does with that. And it may not be enough for some people to just, change what you're eating. That is a very powerful tool. It helps a lot of people. But I'm always troubled by those difficult cases, right? The people who are doing, like you said, everything right and they're following your advice and they're still not quite getting the results. And that led me to, literally looking deeper, right? Looking at things like gut health, looking at bioavailability and nutrient density. And it helps us understand, you know, why. Um, why what I recommended in Stay Off My Operating Table works at a deeper level and what can go wrong with that so that we can help those people that it's not quite getting them the results that they need.
Sure. Let's take it to the 101 level for a minute because I have so many friends who, when I do see them, they're like, I'm doing my best, Shivani. And by the way, like, don't look at my Diet Coke and don't look at what I'm eating. And I'm always like, I'm not going to judge you. We're all going to have our treats. We're all going to have our favorite little crutches that we use or cheat foods, you can call them, whatever your languaging is around them. But it's more about the totality of what you're doing in your diet and nutrition. And so in the book, you really broke down. I was even like folding over the pages last night in your book, and I folded over around bioavailability and nutrient absorption because I think people forget that you're eating great things, but if you're not absorbing it, what's the point? And we're living through a moment where really the protein forward conversation is so big. And what if you don't have, in my terminology, we call it a gut digestive fire, but what if you don't have the digestive enzymes and the support to process it all? You're going to end up constipated and you might not be absorbing the benefit. So will you break that down for the audience just as like that 101 reminder of what we're talking about here?
Yeah, and this really takes us back to the true basics, right? Of why do we eat, right? The reason that we eat is for two purposes and two purposes only. Number one is to get the nutrients that our body needs to fuel and run all of the processes, right? All of those cellular processes that go on within our body. And number two is to get the building blocks that we need to build and rebuild our tissues. And those are processes that are constantly going on within our bodies. And when we really step back and reframe things under that discussion, right, it changes how you look at what you are putting in your mouth. Because when we look at things like nutrient density, right, and we look at the bioavailability of those nutrients within the foods and the bioavailability of the building blocks, right, which is the protein essentially, the amino acids that we need, that changes how we evaluate what we put in our mouth. For far too long, right, the conversation has really centered around energy density, caloric density, right? It's all about, energy in, energy out, calories in, calories out, right? And that was the main focus of our nutritional advice to people. And refocusing on what are the foods that have the nutrients that my body needs, and in which foods can my body best absorb and utilize those nutrients. That really leads to a different conversation around health. And then finally, understanding how that then impacts your overall health, right? Whether it's the heart disease that I talk so much about, whether it's the inflammation that you talk so much about, right? Things like diabetes, cancer, Alzheimer's disease, all of these things that we talk about, we need to realize that they come down to, is your body getting the proper nutrients, and is your body able to absorb and utilize those nutrients and building blocks?
True. No, it's so true. And I know you talk about these hidden offenders that could be in our kitchen that we don't even realize are blocking absorption or that are driving inflammation. And I thought, I love reading about that because we talk a lot in the wellness longevity space right now about anti nutrients and what is really blocking your ability. And I find that piece fascinating because if you juxtapose that against the volume of what's online around what's healthy, what's not healthy, the typical American consumer of Instagram or TikTok content can be really confused right now. It's like, are oats healthy or are they poison? Is spinach good for you or is it bad when it's raw? And so I love in the book, you have a whole section where you really broke that down section by section. You're like, actually, spinach raw might not be good for you. It might affect your ability to absorb. And so, can you talk about that a little bit? Because hidden offenders could be your problem as to why you're blocking your own absorption.
Yeah, it's a very important topic that I think can get very confusing. And honestly, it probably doesn't get talked about enough. But you're right. Oftentimes the information that is out there on it's not communicated in a way that really helps people to understand. Should I be eating this food or not? And maybe even beyond that, right? If I am going to eat this food, are there different ways, right, of preparing it? Are there different things that I can do to overcome some of these challenges? And something like spinach can be a great example, right? And whether or not spinach is truly uh, healthy, we'll call it, right? Whether it's helping your body improve its overall well being is going to be contextual. Um, Ultimately, again, when we take that step back and we say, what are the foods that are most nutrient dense? And what are the foods that our bodies have been optimized on that bioavailability front? Right? Those are two very key questions that we need to ask as human beings. And, I was honored to have the foreword to this book written by Dr. Bill Schindler. And for those in your audience that may not be familiar with Dr. Schindler, he is an anthropologist. He is an anthropologist that has studied the history of food, how we came to eat the things that we ate, how we came to discover ancestrally, right, and from an evolutionary standpoint, that there are foods that if you try to eat them as they appear in nature, right, raw, we'll call it, they're toxic. But if you put them through certain preparation techniques, they can be detoxified and they can really increase that bioavailability. And he wrote a great foreword to the book, and some of his concepts then come back throughout the book to again help us to understand this conundrum. Is something like spinach healthy or is it not healthy? And are there different ways of preparing it that might make it, that might reduce the concerning elements, what we call the anti-nutrients within that food, so that they can be then incorporated into a truly health promoting diet and lifestyle.
For sure. I think looking back at things ancestrally is very informative because we have gotten so far from it. Sometimes I go to the grocery store and I think, is this a food we created or did this always exist? And we're learning slowly that a lot of foods that have been genetically modified and created are really just creations of humanity. And then I wonder, do I have the gut microbiome to absorb that? Does my body know how to break that down? Is it truly beneficial or is it not? And so I know in your book you talk about an elimination diet, which I love because from Ayurveda, I teach we have to look at what do we have to eliminate to win at our health. Oftentimes, we're doing so many great things. I have so many women who are eating clean, super clean, maybe sometimes too clean. They're counting their macros, the protein, carbs, fat, like they're tracking it in the apps. They're even taking amazing supplements because I guide on supplements or they're going to my functional medicine doctors who I love. But they might not be absorbing what their body needs. And so I know in the book you talk about an elimination diet. What is happening in that window that really helps people start to understand what works for them and what doesn't?
Yeah, so, in my mind, again, the elimination diet is the reset, right? And it is a key step for most people in their journey. Because oftentimes we take the opposite approach, right? We start subtracting things one by one, and, we try and judge whether things are getting better or not. And that becomes very difficult, right? Because if you have 20 things in your diet that are causing problems, and you eliminate one of them, right, you may not really recognize much of a difference. But if we can really get back to what is the minimum, right? What is the truly essential things that we as human beings can survive on? And let's just start there. And again, that sometimes sounds scary to people because when you talk to people about, okay, you're only going to eat red meat, right, as a elimination diet, a carnivore diet. People get intimidated by that, right? And what I want people to understand is I'm not saying that you're only going to eat red meat for the rest of your life. What we are acknowledging there, and again, carnivore isn't the only way to do this, but it's one way to do it, is that, okay, as human beings, we can survive. We can truly get everything we need from red meat. So if we only eat red meat for 3 or 4 weeks, right, a 4 week elimination plan that we talk about. And honestly, I tell most people just start with 1 week, right? Because again, they can be very intimidated by that. But I say, okay, let's just start and let's see what happens and let's see how you feel. And most people, they get great results from that because, the honest truth is that 90% of what's out there in our food environment these days is not doing any benefit and is actively harming our health. So let's cut it all out. Let's get to the basics and then let's start building back on top of that. And again, it's not saying that this is what you're going to do for the rest of your life. It's let's get your body reset. Let's see how it does when you're giving it the most nutrient dense, the most bioavailable food that is, available to us as human beings. And that can be a great way to kind of start this process and help you understand how your body reacts to these things.
Absolutely. You said something interesting there. You said up to 90% of what's out there isn't actually helping us. And I think about that a lot because when we're talking to people, a lot of times if you go to the doctor, for example, you're told eat healthier, eat in a caloric deficit, make sure you're exercising enough. And when you ask what's a good diet, people say, well, the Mediterranean diet's great, eat for variety, eat those lean proteins. Or we're told just eat the rainbow, eat plant based. And I think to myself, like, we're not given direct guidance. And so a lot of people I know are like, I'm guessing, I'm doing my best, I'm trying. But I always worry if we lack vitamins and minerals in the soil, what are we getting out of this food? And if this food traveled thousands of miles and lost all of its nutrient density on the way to me, that might be why I eat meals and just don't feel satisfied at all. And so, as you guide people, carnivore is one diet that is medicinal and it can be used as a treatment methodology to help people and to reset the gut. I've seen many of my colleagues say that. What are some of the results you've seen from people doing this type of diet? And when you were trying to guide people before, were you finding that, like, you got them close to healthy, but this was like a turning point in terms of the results that they got?
Yeah. So, and again, I can go back to my personal story here. And it's one that I think will resonate with you because it centers on inflammation. So I had gone on a, low carb ketogenic diet, lost a lot of weight. Was feeling remarkably better. But I had one persistent problem. I had plantar fasciitis, inflammation within my foot that I just could not get rid of. Right, I would rest it, I would do all the stuff, all the stretches, the exercises, all of that, and I could not get rid of this plantar fasciitis. Um, Not because of that, but coincidentally, right? This was about the time that I discovered the carnivore diet, and I said, okay, I'm going to give that a try. And I was doing very low carb. I was pretty close to it, I would say, on my very low carb ketogenic diet. But I said, let me try this carnivore diet, meat only for, 30 days and see what happens. The third day of eating a pure carnivore diet, meat only, I got out of bed, and for the first time in years, my foot did not hurt when I, kind of stepped out of bed for the first time. And that inflammation, that persistent inflammation in my foot disappeared. Um, Early on, if I would start to add back some things, right, non-carnivore, I would start to feel it in that foot. So, it shows you the power of resolving inflammation. Now, I've had patients, which since then, right, with much more significant problems, right? Severe forms of irritable bowel disease, Crohn's disease, ulcerative colitis, inflammation levels that are sky high when we're looking at in the context of things like heart disease. And they go on a carnivore diet for 30 days, and the results can truly be transformative. I've seen people bring down inflammation levels from very high numbers. We're talking like 15 or 20 on an HSCRP, down to 1 or 2 very low levels with 30 days of a carnivore diet, for instance. So the elimination diet can be very powerful, and of course the symptom relief that comes with that is even better.
Thank you for sharing your experience because oftentimes we need to hear a success story from someone else. And so it sounds like you discovered that this diet created such a profound change for you and for others. And my follow up question to that is you're right. Most of the time, when we're given a restrictive diet like this, people do get scared. They're like, what do you mean, red meat only? And I have worked with clients before where the more we do restrict them down to certain foods, it's almost like you wash away all the confusion. You wash away all the different inputs that could be causing trouble. Like you said, coffee, tea. I mean, when you really take everything out on an elimination diet, I think you're clearing the decks and allowing the body, the gut health to really reset the whole system and start to win. And so I guess my first follow-up question is, as I was sharing you before we started recording, I shared with you that I'm vegetarian. And as I was reading your book in bed last night, I was like, oh my gosh, he really has an honest conversation about veganism. And I have done pretty much, I wouldn't say every diet on earth because I don't eat red meat, but I've done veganism. I've tried raw veganism. And what I saw for myself was it was extremely depleting. Like it was not the right plan for me. And I've been to retreat centers and I've taken my mom. My mom is a diabetic, where we were able to really like reset her system using those types of raw vegan plans. We don't sustain those over the long haul, but in a very medicinal way, wheatgrass and all these things can be very healing. And we've done that a couple times. And so my question is, will you talk about veganism and vegetarianism? I myself always consider myself a guinea pig. I love to know what is going on, what are the deficiencies, why are they there, and how do we change them? And what is that root cause issue? And a conversation I'm now having with functional medicine 5 years in on all this testing, lots of expensive testing, is there are some key deficiencies, and those are diet related. So the diet has to shift, or you will have to supplement heavily to meet this need. And I'm in a functional medicine course right now, and what I'm learning is it's not just supplement, like it's full spectrum supplementation. It's all the cofactors, all the enzymes. Like it's more of a spectrum than just, oh, I can take these 5 supplements and win. And so will you speak into that and the experience of your co-author when it comes to veganism? Because there might be different people on different spectrums of diets listening. And I think it's good to understand why your health struggles or energy levels could be tied to your diet.
Yeah, and these are very important concepts. And again, one of the main purposes of writing this book was so that we could have that honest and informed conversation around it. And my co-author, Joshua Lysick, his experience very much contributes here. So the fun fact about Joshua that we talk about in the book is so Joshua was the ghostwriter on my first book, Stay Off My Operating Table. And at the time that he wrote that book with me, he was vegan. He had been vegan for a long period of time. Um, I knew this, right? And when we were discussing writing the book together, we had a conversation. I said, Joshua, you know that I am a big advocate for eating meat. This book, while again, in neither Stay Off My Operating Table or Stay Off My Kitchen Table do we say that, carnivore is the only way to do it. We put it forth as an option, and we talk about why I think it is one of the better options out there. And he assured me at the time and said, this is your book. I write it for you. It doesn't matter what I believe, what I think. And he did a great job writing that book. The results, speak for themselves. But during that process, we had some conversations about his health. And, I made some recommendations to him. And one of the recommendations was around that he may want to incorporate meat into his diet because of some of these unique nutritional benefits of it. He didn't at the time, but as the years went on, more issues arose, and ultimately he did make the choice to reintroduce meat into his diet, and he has had amazing results from it. And we go into all those details in the book. Now, what I want people to understand about vegan diets is this. Um, they have the elimination part that we were just talking about, right? When done properly, I'll call it a whole food plant-based diet, does get rid of a lot of the things that are toxic and damaging within our food supply. If you're truly staying away from the overly processed foods, you've got that box checked, and a lot of people do see remarkable improvements because of that. Now, the other thing, the issues that come up with the vegan diet is that when we look at that nutrient density, we have a problem because yes, these plants have the nutrients in them, but they're not very densely. They're not dense within those foods, so you end up having to eat a lot of them to get the proper amounts of many of these nutrients. And then we also start to see some bioavailability problems. And this, again, particularly comes up when we start talking about the proteins that are within the plant foods. Yes, there's protein in there. Yes, there are certain amino acids. The full spectrum of amino acids that our body needs are difficult to get. And the forms that these things are in are oftentimes different than what our bodies are looking for. Many of these nutrients, the vitamins, the minerals that we talk about, they have forms that plants store them in and utilize them in. And they have forms that animals, like humans, store and utilize them in. And it may not be quite exactly the same thing, right? It's sort of like different dialects of a language, right? You might be able to sort of, fake your way through that conversation with someone that's speaking the different dialect, but there's going to be some miscommunication, some misunderstanding. And we see the same thing when we look at the plant forms of something like a vitamin D, right? And we look at the animal form of a vitamin D. And yes, they're both called vitamin D, but our bodies respond to them in different ways. And one may not be able to substitute for the other. So ultimately, when you evaluate a vegan diet, and the leading vegan advocates will, do admit this, right? It is mandatory to supplement on a vegan diet. If you are going to be healthy over the long term on a vegan diet, you have to supplement. And then even, when you're talking about trying to get all the different nutrients and amino acids from the proteins that we need. It becomes a very complex sort of planning operation, and I think that's ultimately why people end up over the long run having trouble with it. And
Sure.
again, that is the conversation that we have in the book. And I am not here to tell anyone, right, that there is one way and only one way to eat. I'm here to help inform people. And, ultimately, as a surgeon, right, I think this kind of comes from my surgical background. I am very outcomes focused. If you are truly getting the health outcomes that you are looking for and you need, on whatever plan you're on, I'm going to be supportive of that. But you have to be honest with yourself. You have to be doing the right testing, and when we get to things like insulin resistance and metabolic health and inflammation, and you're looking at those markers, if you're not getting the results that you're looking for, whether you're on a carnivore diet, a vegan diet, or something in between, you need to be asking why. And again, I hope that the concepts in the book can help people to start to evaluate and understand that.
True, it's so true, and I work so hard to understand nutrient density, bioavailability, deficiencies. It's funny, as you were speaking, I have my aminos in my water, and every day now I have 2 full big glasses of aminos in my water, and when I took a sip, my whole body was like, "Thank you." And that's always a sign to me when my body's, like, relieved that I'm eating or drinking something, it shows you how much the body needed the thing that you were not giving it in another form. And so that's also a piece of the puzzle, right? Like, where are we not giving our body the nutrients, the nutrient density, the foods that are bioavailable to us that we need to just function well? And then you mentioned with the example of your co-author, as he aged, things changed. And I think we're seeing that big time right now. We're having a heyday in the conversation of midlife women, perimenopause, menopause. And I know that in that demographic, as we are aging, I'm 45, right in the middle of the perimenopause years. It's not easy. We all of a sudden hit walls with our health, and it's like, boom, okay, now I got to calibrate to this new change. I have to adjust my diet and everything for this. And I know that heart health is a big conversation. They say heart health is our number one killer. We have to focus on it. But one thing I've also noticed is most women who I talk to say, "Whoa, I hit the perimenopause years. My cholesterol skyrocketed. I didn't change anything. I didn't change my diet. I didn't change my stress levels. I didn't really change my workouts. I'm doing what I'm supposed to do." And so, how do you guide women who are in this transition time on why their cholesterol skyrocketing? Because what I see is everyone's told, just take a statin. And I'm like, well, if it's all of us, how is that the only like magical solution that we're being offered? Why aren't we being given more solutions instead of just slap a pill on that problem?
Yeah, so a couple of complicated topics to get into, but we're going to try and get through them here. So, first of all, when it comes to women's health, yes, heart disease is the number one killer of both women and men. And that's true here in the United States, and that is true worldwide. That oftentimes gets misunderstood. Women do have the advantage that their risk of heart disease is lower than men before they go through menopause. But in the perimenopause and menopause period, they rapidly catch up. And essentially, one of the major factors here is estrogen is somewhat protective against a couple of different aspects of heart disease. And as women's estrogen levels decline, going through that transition, their risk of heart disease starts to increase. I always tell women, yes, your risk of heart disease lags about a decade behind men, but it is still there, it is still prominent, and it really should still be your number one concern when it comes to your health. Because if you're betting on what a woman is going to die of, the right bet is heart disease, because it is the number one killer of women.
Wow.
Now, the whole conversation about what drives heart disease, right? That is a big focus of my work. And here again, what I was educated to believe, right, that cholesterol is the cause of heart disease, and that high cholesterol levels are the number one risk factor that people should be focused on. It turns out that neither of those are true. Um, Cholesterol plays a role in the development of heart disease, but it is not the primary driver of heart disease. And just looking at the amount of cholesterol that we have in our bloodstream, the cholesterol levels that your doctors talk to you so much about, is a lousy predictor of your heart disease risk. It turns out that the quality of your cholesterol, which is a very different thing and needs to be tested in a different way, is important. But even more important becomes insulin resistance, inflammation. And I know, of course, that second one is very near and dear to your heart, so to speak. But those are underappreciated and oftentimes ignored risk factors when it comes to heart disease. And so when I'm talking with people, when I'm talking with my patients, that's how I help to shift that conversation and help them understand what their true risk of heart disease is.
You know, my whole family's history is diabetes across the board, both sides, all grandparents. And growing up, I'm Indian. So every time I went to India, I would see my grandfather had a heart attack. My grandma needed a quadruple bypass. Then my parent generation now is in their 70s. I'm seeing that happen across the board, heart attacks, saved in the nick of time. And oftentimes not. You know, when we talk about what takes out the Indian men in our lives, a lot of times it is the heart attacks that happen. So, my question is that true across many ethnicities? Is it unique to Indians? Because I don't think it is. And then, secondly, that conversation around insulin resistance, inflammation, you know, I think we're getting it all wrong. As a society, when I go to Houston, I'm from Houston, Texas, I'm always like, oh my gosh, my A1C climbed. And they're like, you climbed by point 0.1 and you're stressed about it? I'm like, yeah, point 0.1 is one more step towards diabetes land. My whole job is to prevent ever having this disease. And they're like, you are great. We're all in the sevens. We're above 7. We're all taking our insulin. We're all on full dose, max dose GLPs. And I'm like, guys, you're trying to manage a problem, but you're not willing to make the underlying changes to win at your inflammation and all these things. And so, do you guide women or women and men to go get a, you know, I think it's called the calcium cardiac score, the calcium
Mhm.
CT. I forgot what it's called, but you can tell us. I had that done. I got a 0. My doctor was like, "Good job, Shivani. I'm happy with that number. 0 is good." I was like, "Okay, great." You know, there is the omega 369 conversation that we oftentimes forget about, and we're all eating more towards omega 6, omega 9, and forgetting to even check our omega 3s. And so, will you speak into the things we should be looking at? And I know you in the book actually go deep into the blood work panels we should be paying attention to because most people think they are just fine. And I look at everyone and I'm like, you guys are ticking time bombs. And for example, today I just sent my car in and my car guy sent me a picture and he's like, Shivani, this is your axle. Literally, the axle was shredded. And I thought, isn't that a perfect metaphor for our health? Like, we're running around with shredded parts on the inside, with laid down cholesterol, clogged arteries, and people end up on your operating table without ever having realized the time bomb that they were or the stopgaps they could have put in place.
Yeah, a lot to unpack there. So, when it comes to heart disease these days, I talk about the three I's that we don't see. And this is inflammation, insulin resistance, and the imaging, and exactly what you touched on. Now, I want to first start with, the first part of your question about, Indian genetics. And it turns out that Indian genetics do have sort of a double whammy when it comes to heart disease. And what's interesting, when you look at the incidence of diabetes and heart disease in India, it is astronomically high. It has been increasing dramatically over the past couple of decades, the past two generations, we'll say. But what's different from the United States is that obesity, right, has not had that same trajectory. And it turns out that Indians and Southeast Asians more broadly have a genetic issue in that they actually don't get fat. And, that's going to sound a little strange, being able to get fat, if it comes from subcutaneous fat, right, that fat on the outside, that is somewhat protective against metabolic disease. And people that can't get large amounts of subcutaneous fat and instead immediately start forming what we call visceral fat, right? That fat on the inside around the guts, that is the origin of metabolic disease, of insulin resistance. That becomes very problematic. And Indians, because of their genetics, they do not really get the subcutaneous, the outside fat. They get very quickly the visceral fat, and they very quickly become insulin resistant and diabetic. And when you add in a high carbohydrate diet, right? And when you especially add in the shift in the types of fats that were used traditionally in Indian cooking, right? You got away from using things like ghee and butter, and instead using vegetable and seed oils. And it turns out that that really compounds this problem because at the mitochondrial level, those vegetable and seed oils, they drive insulin resistance. So, unfortunately, the answer is yes. Your genetics are working against you. However, I always tell people, right? Genetics load the gun, but it's your lifestyle and your habits that pull the trigger. And so, what is the positive side of this is we see great responses from Indian people in this situation who go on a low carb diet, and they eliminate things like vegetable and seed oils, and they eliminate the processed food, and they go on low carb diets, and that hemoglobin A1C of 7 and 8 can quickly come down to, 5, 5.2, 5.4, the normal levels, when we make the right diet and lifestyle changes. So I very much believe in empowering, and, your genetics are not your destiny. The imaging is crucially important. And again, it's something that is very underutilized within our medical system, because it's one thing to talk about all the blood work. And like I said, we have a very extensive section in the book about what is the right blood work to be looking at, how to interpret it. And people can take that to their doctors and say, these are the tests that I need. And if your doctor, for some reason, won't order it for you, here in the United States, we have lots of options. You can order it for yourself, and you can use the book to help you understand it. But there is no blood test that shows us whether or not we have heart disease. Despite all of the discussion that we have around cholesterol, your blood cholesterol levels do not tell you whether or not you have plaque in the arteries of your heart or not. Right? It is only the imaging that can show us that. And the good news is that we have great, simple imaging that can be done today. You mentioned the test. It's called a coronary artery calcium scan. You might hear it called a CT coronary scan, or a CT calcium scan. And this shows us at its earliest stages whether or not plaque, specifically calcified plaque, is forming in the arteries of your heart. It is a great screening test. It is an inexpensive test. Most places in the United States, it's going to cost you less than $200, oftentimes less than $100. It literally takes 2 minutes to do the scan. They don't have to put an IV in you. It is very simple to do, and it is a low radiation dosage so that the test can be repeated over time. I recommend at this point that all men, by the time they are 40, should have their first coronary calcium scan, and all women, by the time they're 50, should have their first coronary calcium scan. And if you have some of the things that make us more worried about heart disease, if you already are diagnosed with insulin resistance, with diabetes, if you have that strong family history, go get that scan earlier. Because the shocking reality that I have seen throughout my career as a heart surgeon is I now have 30-year-olds ending up on my operating table on a routine basis. And that was literally unheard of 25 years ago when I started my career as a heart surgeon. We operated on 70 and 80-year-olds. We'd have some 60-year-olds, and the 50-year-olds were kind of surprising to us back then. And just, like I said, 25 years later, I now routinely am seeing 30 and 40-year-olds ending up on the operating table.
Wow, that's insane. What a shift. I mean, we're seeing so
Yeah.
many shifts like that. I spend so much time with doctors and surgeons, and it's interesting to hear those comments like, wow, we're seeing eye disease so much younger. Wow, we're seeing degeneration so much younger. People needing really big surgeries in their 30s. And so I know that when it comes to all these things we're talking about today, what do you see as like the food? I look at it as big food, big pharma, but the food and the pharmaceuticals industries, what do you see them getting wrong or don't want us to know about this relationship between diet and disease? And why is it that the 30-year-olds are ending up on the table?
Yeah, so the big problem, I think that we've got into, right, is, uh, listen, modern medicine, right, is miraculous, and there are so many examples of things that we can point to, right, that people used to die from that we can now fix with things like medicine and surgery. However, what I came to realize as a surgeon, as a heart surgeon is, no matter how good a job I might do with that heart surgery on that person, um, they are never as good as they would have been if they didn't need the surgery in the first place. And the same thing can be applied to the pharmaceuticals, right? These medications can do great things. However, if you never develop the problem that requires the medication in the first place, you're going to be much better off. So, focusing on prevention, right, and doing that through things like diet and lifestyle, that's where we're really going to start to change the trajectory around our health. And that is very much what I believe in. I am not satisfied, right, that heart disease remains the number one killer. I am not satisfied that there is a shortage of heart surgeons in this country. There are not enough surgeons to do all the surgery that needs to be done. And when I look at that today, what I realize is the problem isn't how many surgeons we have. The problem is how many sick people need heart surgery. In my mind, in the mind of many others, 90 to 95% of the most routine heart surgeries that I perform, what are called a coronary artery bypass, right? Because of that buildup of plaque that has occurred in people's hearts, 90 to 95% of them should not need to be done. They are failures, and they are not individual failures of the patient. They are failures of the medical system because we have not properly empowered people to understand what is truly the driving force behind their heart disease and what they, the individual, can do to change it. Not take the medicine, not the doctor has to change this for you. You, as an individual, have the power to change what you are eating and how you are living. And that can have a massive impact on your risk of then ending up on my operating table.
I love that. I think that was the perfect way to wrap up our podcast today. I have one final question. I recently saw a woman named Tamsin Fadal. She is very well known in the menopause space. She's part of the creation of the M Factor documentary, and I love those documentary viewings and stuff. I've been attending, and I'm going to be speaking at one later this year. And she went to see a cardiologist as a preventive appointment, and she shared about it. And I thought, I'm 45. Normally, as women, we go to our OB as our primary care because they can usually cover us, or we go to a primary care doc. I truly believe everyone needs functional medicine level workup. but it's what you can afford and what you can get to. But when it comes to going to the cardiologist and just having the conversation of where do I stand, I'm lucky I went to functional medicine 5 years ago, and she goes, "That is your heart health history. I need full omega-3 panel. I need the CT scan of your heart. I need data because you could be the worst ticking time bomb, and we don't know it." And then once we tested, she was like, "Okay, actually, you're good from now. Let's keep working on pre-diabetes because that's such a history in your family, and if you're not careful with your vegetarian diet that tends to be too high carb, especially the Indians, we eat all the rice and grains and potatoes. I cut all those things out and created the shifts that we talked about. Um, I feel like, are we supposed to be going for this as a preventive appointment to have that conversation much earlier than we realize?
Um, I would say yes and no, right? So, yes, I do believe we should be focusing on the prevention of heart disease much earlier. The problem is that the mainstream approach to that prevention is ineffective, right? And if you are only focused on cholesterol, as most cardiologists are, you're not going to be successful in preventing the heart disease. If you're focused on the things that we've been discussing, and I agree with you, the functional medicine approach oftentimes does a lot better job at this, right? Looking for the insulin resistance, looking for the inflammation, and looking at that imaging early to really help guide us towards preventing heart disease. And I am optimistic. I do believe that the future of heart disease is bright. I do believe that before I leave this earth, heart disease will no longer be the number one killer. But that's only going to happen if we change our thinking around heart disease. If we finally admit that the cholesterol centric approach to this disease has failed, and we need a different approach. That's how we're going to truly change the narrative. And if people then take a preventative approach based on those concepts, that is where the success is going to come from.
Awesome. Thank you. I've learned so much from you today. I love having conversations like this about deep prevention, the steps we should take, the things we need to pay attention to. Even this idea of cholesterol is not enough data. Guys, we need a lot better data on you to understand, and you need to really take the power back in terms of your role in your own heart disease journey. I think is really powerful. And so thank you for writing this book, Stay Off My Kitchen Table, after your book, Stay Off the Operating Table. I really enjoyed reading it. I find it to be such a good guidebook. You've got charts in here, you've got journals, things for us to fill out and keep track of. And so I really loved it as a working guidebook for nutrition and health, and really having that deep conversation on bioavailability and nutrient absorption that I think is more important than ever, because if we forget that piece, we're wasting our time and money just stuffing everything in, but not necessarily absorbing it. And so, Dr. Ovadia, will you share where everyone can find you online, where they can find your book, and pick up this wonderful resource for themselves?
Yeah, thank you very much. That's what we intended it to be. The book is widely available, all of the usual places that people buy books from: Amazon, Barnes and Noble, etc. You can also go to stayoffmykitchentable.com, and we have some bonuses tied to the release of the book that people can take advantage of. And then to find me, I am at iFixHearts everywhere. So all the social media at iFixHearts, and you can go to ifixhearts.com. I have a nationwide telemedicine practice. I work with people one on one, me and my amazing team of health coaches, nurse practitioners. We are, helping people to implement the concepts that we talk about in the books, and would welcome the opportunity to work with anyone listening to this.
Awesome. That's amazing. Thank you so much for coming onto the podcast today. Thank you for everyone who listened in to the Inflammation Code podcast. It's me, your host, Dr. Shivani Gupta. So for more info on the podcast, you can visit drshivani.com, and make sure you share this episode with someone in your life you love. I know I'm going to be sharing it with my own family, all sitting in Texas who need this wisdom. And make sure you share it with someone you love because this wisdom needs to get out there in the world. This is how we take care of each other and spread the wisdom of integrative medicine, preventive medicine, and take that power back for the health that we all deserve. So, thank you, Dr. Ovadia, for coming on and writing this incredible book. And I'll see you guys next week for the next episode.